Welcome back and good morning. Central Oregon has allergy season started in Central Oregon. If you ask half my family, they would say, oh yes it has. Joining me this morning is Dr. Adam Williams from Ben Memorial Clinic. Good morning.
Good morning.
So has it started?
It started this
Okay.
week, definitely. By all accounts, your family, my patients, our pollen counter, it definitely hit this week.
It definitely hit. So what are the major allergens in Central Oregon?
Most people are probably aware that juniper is the first thing, and that's what the only thing that's really pollinating in large quantities right now.
Okay.
So, of course, that's the big one people know about. And then after juniper is the deciduous trees for April and May. And then grass pollen season is May, June, and July. And then the weeds. We have obviously significant amounts of sagebrush and rabbitbrush and other weeds that take us through August, September, and October.
We have a very long allergy season or allergen season in Central Oregon.
It can account for 6-7 months of the year.
Yeah, and it makes people just absolutely miserable. How do you differentiate between allergy symptoms and if you have a cold?
Well, I mean, I think for someone who's never suffered from allergies, a good analogy is trying to imagine having a cold all the time for 6 months of the year. So they can be very similar and difficult to differentiate. But I would definitely say that allergies tend to have a lot of sneezing, a lot of itching, especially itchy eyes, but often very difficult. A lot of similar symptoms between the two. Symptoms going on for weeks and weeks obviously is more likely to be an allergy.
What are the steps that somebody who suffers from a seasonal allergy can take to limit their exposure? I mean, obviously you cannot stop going outside, but
Right.
you can limit the time you're out there, right?
Or pick the days that you go outside if at all possible. Not going outside on windy days. Keeping the windows closed at night. As tempting as it is when the weather gets nice to leave our windows open at night, and early morning is really a time when a lot of pollen gets into the air. So keeping the windows closed during those times of year can actually keep the pollen loads out of the house. When you do go outside, either wearing a mask if you can, or as soon as you come back in, taking the clothes off that you had, get in the shower, rinse all the pollen off, and put on a fresh set of clothes often can help reduce the indoor pollen exposure.
So the wind, I mean, we've seen some very gusty winds over the last couple days. That can really pick up that pollen.
Those are the days that really are going to have the highest pollen levels, the dry, sunny, windy days.
The rain helps.
It does help.
We don't love it here, but believe it or not, it's helpful for us.
Most patients will tell you that after a rainy day is when they really do the best.
You and I were talking before we came on, and the rain that we're expecting tomorrow might actually help folks who are suffering today.
It should.
Yeah.
At least give them a temporary relief.
Are there any medications that can help the treatment of nasal allergies?
So there's over-the-counter things. There's the saline nasal sprays. A lot of people really swear by those, and those can really wash away the pollen and the inflammatory molecules that the body makes in response to an allergic reaction in the nose and eyes. Then there's over-the-counter antihistamines, and we're very fortunate this day and age to have 3 very good antihistamines that last all day that don't make people sleepy, and so that's really great. And then now there's a wide array of eye drops that people can get over the counter. When those aren't working, there's prescription medicines. Nasal sprays is the most commonly used prescription. Anti-inflammatory nasal sprays is what most doctors will turn to first.
Okay. You probably see a lot of people who are just kind of at the end of their rope.
I do.
They don't know what to do.
We do. We see people who have kind of tried everything, been there, done that, and we're looking for other solutions.
Do you have some good solutions that you can prescribe?
First of all, we help optimize the management of the things that they're already using. And if they're still not doing things exactly, if they're still not getting adequate relief from those, we have this thing called allergy shots. And allergy shots is kind of a definitive treatment for a lot of people where nothing else works. We give people injections of the things they're allergic to on a regular basis, monthly, and it can really knock down their suffering level significantly. So
you give them injections of, let's say somebody's allergic to juniper. You actually are putting juniper into their body to build up those antibodies?
That's correct. It's a sterilized extract of juniper pollen protein, the thing that they're reacting to. And by doing that, giving people continuous doses of the thing they're allergic to, somehow, we don't fully understand how, it actually turns down the immune system's tendency to respond to these things.
So an allergist, going to someone like you, can really help these folks?
It's definitely a place to come for sure if people are continuing to suffer.
Yeah, and I bet you just here in Central Oregon is such a hot spot for this.
It sure is.
But you're a busy guy.
We keep pretty busy.
Yeah.
Yeah.
If people have questions, if you have any questions about what Dr. Williams spoke about this morning or any other questions regarding allergies, things like that, 541-382-2811 is the number at Ben Memorial Clinic, and then benmemorialclinic.com is where you can find out more information about Dr. Williams and the other providers. So it was great to see you this morning.
Thank you. Thanks for having me.
Thank you. And great great information, great tips for my guys that are suffering at home. So.
Good.
We're